As I said, I'm Jenna Slotin, the Director of Policy from the Global Partnership for Sustainable Development Data, and we're the host of the Inclusive Data Charter. We're grateful to all of you who've joined us today to discuss how we use data disaggregation to identify, understand, and address the needs of the most marginalized people in our society. The 2030 Agenda puts a spotlight on this need and has catalyzed much action. I remember when the Inclusive Data Charter was launched in 2018. The interest and excitement around how the IDC could spur concrete action on the Leave No One Behind agenda by improving data on marginalized groups. It's very exciting to see how thinking, methods, and approaches have evolved since then, and particularly how the challenges posed by the pandemic have accelerated interest in getting at even more complex challenges, such as those posed by intersectionality. Much has been achieved in the last few years, but there's still very much to do to generate the data required to ensure that no one is left behind. So during today's session, we'll be exploring the importance of data disaggregation by multiple dimensions to identify and support the most marginalized people who are at risk of being left behind. We'll start off with a short introduction on what an intersectional approach to data means, followed by a case study from DANE, the National Statistical Office of Colombia. We'll then move into exploring what these approaches look like in practice by hearing from several institutions on how they have implemented multidimensional disaggregation. In the interest of time, I'll introduce the speakers as we go. So before we begin, a few quick housekeeping notes. We'll be using Slido throughout the event to gather your insights, ideas, and questions. On the screen in a moment, you'll see the joining information for Slido. Let's just make sure that's up. There we go. So you can scan this image on your phone, or you can join Slido on your computer by clicking on the link shared in the chat box now. We encourage you to ask questions throughout on Slido, so not in the Zoom chat, but rather on Slido. And you'll also be able to respond directly on there by sharing your own views or experiences, or by upvoting questions that you particularly want to see discussed by the speakers. We'll have some time towards the end of the session for the speakers to answer any of these questions from the audience, but we do encourage you to use the interactive platform throughout. So without further ado, I'd like to turn over now to Mike Bolton. Mike Bolton is the technical advisor to the Inclusive Data Charter on secondment from the UK Office of National Statistics. Mike will be setting the context for today's conversation on data disaggregation. Over to you, Mike.
Thank you, Jenna, and good morning, good afternoon, good evening to everybody joining us today. Thank you very much for joining us for what we hope is going to be a very interesting discussion around the topic of intersectionality. Now, we all know that embedded within the 2030 Agenda is the importance of leaving no one behind. And I'm sure we're all aware that data disaggregation is the key to doing this. However, there's growing recognition that using a singular dimensional approach to data disaggregation simply doesn't do enough to ensure that the most marginalized in our societies are identified within data sets. Next slide, please. So these are just some of the dimensions that are mentioned within the 2030 Agenda, along with some other important ones that we've come across when working with some of our champions and partners. So inequalities often overlap or intersect in ways that create new and compound existing deprivation. Next slide, please, teacher. A multidimensional or intersectional approach to data disaggregation is therefore required to identify and reach the furthest behind in our societies. Now, in our work, we've come across many different terms and ideas about what intersectionality actually is. So I wanted to start by collecting some data from you all. We're going to do this by using Slido. Next slide, please, teacher. So please participate in this Slido by using the links that have been provided already. And please answer the following question. What word comes to mind when you hear the phrase intersectional approaches to data? So we'll pause for a minute there to give everybody a chance to participate in that. If you are having any difficulties in joining the Slido, then please add a comment in the chat and we'll do our best to help you to access that. So we have some words popping up already, such as inclusive and inclusion, perhaps unsurprisingly. We have some key characteristics in there, like gender popping up. Analysis, definitely a key point to see there. If you could keep adding those in, that would be great. We'll leave this Slido open for a few more minutes if you want to continue to add your thoughts around what you think about when you think of an intersectional approach to data. Multidimensional. So we're seeing lots of different characteristics in there, such as gender, race, ethnicity. Brilliant. So keep those coming in and I will carry on speaking for a second, and perhaps we'll have a chance to come back to this slide in a few minutes' time. So when talking to some of our partners, intersectionality has come up under many different guises in these conversations. And we've been having these conversations with many of our champions within the Inclusive Data Charter network. The Charter is a multi-stakeholder initiative involving a really broad set of organizations. Next slide, please, teacher. And these organizations involve national statistical offices, line ministries, civil society organizations, as well as multilateral agencies. And this broadness in organization type really feeds through into the areas of interest of these champions. We have, for example, experts in disability, homelessness, internal displacement, and aging, to name but a few. But these experts know that a person's position in society often reflects multiple aspects of their identity. And it's how these aspects intersect, often reinforcing each other, that creates interlocking systems of inequalities. If we treat disaggregations with a one-dimensional approach, we risk people facing the most risk and the most vulnerability in our societies, facing further discrimination and falling through the cracks. Taking these issues together are integral to resolving these social inequalities because they enable practitioners and policymakers to provide better targeted support that responds to the needs of the most marginalized. Now, we obviously need more support and more resources to commit to generating good quality data disaggregated by multiple dimensions. The work of the Inclusive Data Charter as a network is incredibly important for the growth and development of intersectional analyses. We know that it's important to include citizens we aim to support in asking them what is needed and how their own intersectional experience is reflected in our survey tools, our questionnaires, and ultimately our policies and practice. And this remains a long-standing challenge. But the challenges related to intersectional approaches will not be solved with more or better data or more participation alone. We need to think creatively and consider what we are really trying to achieve with this data. What different data sources can be brought together to tell a richer picture, to fill data gaps when there just isn't enough data to do what we've always done. It means collecting and valuing qualitative data, or grappling with whether it makes any sense to link surveys together methodologically, or it means experimenting with new sources of big data. All of these approaches are incredibly difficult to do. It requires expertise, commitment, collaboration, and often creativity. And we must remember that it's often when we link these data sets together that new risks for vulnerable people emerge. And that is always a constant challenge that we need to keep at the forefront of our minds. We found that when speaking to our champions and partners, that they're navigating these challenges incredibly well, and they're really innovating in this space. Next slide, please, teacher. So when we've been talking to our champions, we've found that for an intersectional approach to data, we're seeing these 3 I's of good practice pop up under various names. So the first I is inform. Now, there's a lot of work to do to remind decision makers about the need for more disaggregated, inclusive data. I'm really hammering home why an intersectional approach to data matters in certain circumstances. When is it useful? When is it needed? For what purposes? These are all questions our partners are establishing. And you'll see the results of some of these pieces of work from our other speakers later on today. The second I that keeps cropping up is identify. We've seen a lot of agreement across our partners and champions that what is needed first is to identify existing gaps in data, to look at what is currently available and to see what is missing. We're seeing how well-designed programs of data production and related systems facilitate identifying inequalities between groups, or alternatively, how particular groups of people, such as internally displaced people, homeless, or persons with disabilities, experience inequality based on their intersectional experiences. And the final I that we're seeing crop up again and again is intermediate. The most important aspect of our partner and champions' work in this area is the work that they're doing to mobilize collective action through the sharing and use of data. We've seen how there are multiple ways to bring together civil society organizations, governments, and private sector actors to address local challenges through data systems. And whilst it's always challenging to do so effectively, it's incredibly important that we continue to do so in this way. So on that note, I'll hand back to Jenna. Thank you very much.
Thanks so much, Mike. Really helpful laying the groundwork for everyone on intersectionality. Great place to start. So now we're going to go over and hear from Karen Garcia from DANE. Karen will be presenting on DANE's newly launched guidelines to mainstream an intersectional disaggregation approach across Colombia's national statistical system. Now, I'm going to encourage you to put questions for Karen onto the Slido so that we can gather some of those up after she speaks. Go ahead, Karen.
Thank you very much, Jenna, and thank you again for the invitation. It's always a honor to be here talking about these topics. I'm going to begin with the next slide, please, Ticha. And I think this slide is very related with the excellent introduction that Mike just did, because in effect, generative inclusive data is an essential need in order to motivate and inform action to close gaps, but it could be an incredibly complex process because there are a lot of ways to do it. And that's why we have to work from a multidisciplinary approach in order to know how to communicate and what to disaggregate, but also to generate the standards and to agree around basic variables and definitions that are going to be used along all the statistical process. It is always useful to remember in this point that disaggregating and presenting already available data is just the minimum. As Mike told before me, it is necessary to also recognize which are the gaps in the information amount, and also to list all the guidelines that are needed throughout all the phases of the statistical processes, from collection to dissemination of data. And that's why we here in Colombia, as a National Statistical Office, decided to work together in order to produce this document that we just published on last December, with the support by IDC, by the way. Next slide, please, Ticha. So we organized the document based on this structure. In the first part, well, we present the document and we mentioned, in fact, the IDC principles as an inspiration for this view. And after that, we present a conceptual framework that is very important in the document, because there we include basic questions, variables on 5 approaches: gender, life cycle, disability, ethnicity, and peasantry. And we also include other concepts that helped to understand how intersectionality affects the quality of life of people, and create particular situations of life and discrimination. For example, migration, income level, education level, work situation, location, territory, and in the case of Colombia, also to be a victim of the internal conflict. After that, we present a normative framework in order to motivate, inspire, and justify data disaggregation. And after that, we present a brief diagnosis of how are we right now in these approaches in the statistical processes in Colombia, which are the main achievements and challenges. In the 5th chapter, we in fact get into making specific recommendations in order to include these approaches in each one of the phases of the statistical processes, from the identification of needs to the dissemination of information. And at the end, we present some strategic annexes that we put together. For example, inclusive language guidelines. That is something that is still being polemic, I think, in many places of the work. For example, in terms of neutral, gender neutral language. In Spanish, we have, I think, issues that are different, for example, than in English, and also a special section of the state of disaggregation of SDG indicators that we work closely with the SDG indicators team here in DANE. Next slide, please. Well, this was such a this has been such a journey, because we are still on that. But I just want to mention some of the main steps that we worked to construct this document. At the beginning, we had to agree on concepts and basic variables and categories, and to identify the existing ways of capturing information on topics that are complex and that we want to transmit in the historical and appropriate theories that are making the conceptual framework around each one of the approaches. So we organized and worked around internal roundtables with my team, the intersectional and differential approaches unit, and the department within DANE that is in charge of standards, and we agree on the basic concepts, the basic variables, and account for the possible questions to capture this information, to collect this information. And we present this in the first chapter, always trying to cite our norms and the best possible concepts in the United Nations system of guidelines. After that, we will work internally in collecting different guidelines. It was a challenge, for example, to organize and put a point for the recommendations, because we located a lot of guides from all over the world, but each one of these documents were, for example, focused on one of the approaches. For example, statistics for women in agriculture, or disability statistics. But we were trying to collect all these recommendations for an intersectional approach just in one document, and well, this document couldn't be infinite, so it was a challenge. But we made a list of possible documents that people could consult if they want to make some points deeper, and we cite some recommendations from our own experience, as National Statistical Office, as the leaders of the national statistical system, and also cite the international recommendations in this chapter. And well, we with this first draft of the document that we had on February to June of 2020, we made an internal consultation with all the technical directorates within DANE. We reviewed their comments, and this strengthened the second draft of the document. And after that, we, thanks to the support to UN Women, we work together with Mercedes Pedrero Nieto. She's an expert on including these approaches, especially gender, but from an intersectional approach. And she worked in the National Statistical Office in Mexico doing this for several decades. So it was such a honor to work with her. And we also receive comments from other strategic allies, for example, Mike from IDC, and other, for example, academics here in Colombia that sometimes work with us, making advisory for these topics. And after that, we organize an open consultation process in order to receive comments from the community, especially from statistical producers. And we make a format available in our webpage during 3 weeks to receive these comments in an organized way. And next slide, please, Dija. And these commenters that participated in this public process, in this public consultation, well, they qualified us with 4 criteria, and well, this is the average rating that we got. It seems that the document it is clear and is going to be useful or available for using at least because we have more than 4 in each one of the criteria that we propose our commenters. And we receive 59 specific comments from 20 participating entities and NGOs from the national statistical system here in Colombia, including public institutions, for example. Next slide, please, teacher. Well, just talking a bit about the main objective of the document, we want to promote and also guide the inclusion of differential and intersectional approaches in the process of producing statistical information in order to encourage the generation of disaggregated data that accounts for the diversity of population groups based on consistent conceptual frameworks. And I want to mention the main recommendations that we put in the document throughout all the phases of the statistical process. These are things that we are recommending to take into account in all the phases, just to mainstream these recommendations. The first one is awareness and training in differential and intersectional approach. To the teams, to the personnel. These are topics that are in constant development, that need to be worked interdisciplinarity, and that's why we need constant awareness and training. We say yes to inclusive language in all the phases, avoiding the reproduction of stereotypes and being very careful with that. Involvement of the group or unit specialized in differential approaches of the person that are in charge of the topics in order to allow for synergies and to use this expertise. And to take into account that data disaggregation it is not just about presenting tables with available information, but it requires adjustments in all the phases of the statistical process. Next slide, please. And this is the last slide, just some of the changes that the guide proposes in the recommendations. The first one is that the statistical operations in its main objectives must include differential approaches issues. If this is included as an objective mainstreamed in statistical operations, this can be take into account in all the statistical process, not just at the end, but it is going to be considered from the beginning. And of course, very directed to the specific potentials of each kind of statistical operation to produce relevant information for these intersectionality issues. It is also too important. It is important also to consider that it would be necessary to implement specific methodologies to collect, for example, sensible information, such as sexual orientation or gender identity, for example, implementing self-administrated questionnaires. It is also important to make a point of guarantee of rights to the collecting teams, not just concepts, but also to make a training on how this kind of information could affect the rights of the people we are interviewing in our operations. So it is also recommendable to include this in trainings. We also recommend and cite practical examples about integration and exploitation of various sources of information. For example, census and administrative records. They have a special potential to make disaggregation for groups that are statistically small and that may have troubles in representativeness in service. But that's why it is important to exploit and use alternative sources of information in order to make possible more disaggregations and to also take advantage of the richness of the service for some specific topics. And also to motivate special indicators and ways of displaying information that allow to effectively see inequalities in an accessible way and without reinforcing stereotypes. As Mike was explaining at the beginning, it is not easy to show data in a consistent way to show these inequalities and to show gaps. And it is important to give practical examples on how this could be made with already collected information. Thank you very much. I want to thank all the team in DANE for this work, all our allies, including IDC again. Also our director, Juan Daniel Oviedo, who is always in the front line to explain and develop these topics with us. And hello, everybody from Bogota, Colombia. Best wishes.
Thank you so much, Karen. What a pleasure to learn about the journey that you've been on to produce these guidelines, and so much interesting to learn and share as we've seen so far. We have only a couple of minutes. There have been a lot of questions in the Slido. So Karen, I welcome you to go to the Slido after as the others are presenting, and maybe you can throw in some answers yourself. But one question that received the most votes that I'd like to put to you is, what technical and soft skills are needed in NSOs to have more intersectionality in data collection and analysis? So could you respond to that first question at the top that we see on the screen?
Thank you, Jenna. Yes, in fact, this is one of the big challenges of mainstreaming these approaches throughout all the statistical processes. And I think that definitely we need to understand that these topics require and a multidisciplinary point of view. So as technical skills, I would suggest, for example, to present practical examples of how may look tables and bars and graphs that in fact are being presented in order to show gaps and to show differences without reinforcing stereotypes. And that means to put specific, for example, messages or concepts or words that are not reinforcing this victimization language, but to empower recognizing historical differences and historical discrimination. So this need a learning in indicators in the structure of presenting tables also, and experience on that, but also this advisory on historical issues and human rights and respect to the diversity.
Thank you so much, Karen. That's fantastic. Such an interesting conversation so far, and looking forward now to move over to a couple of our other speakers. So now we'll hear from some institutions that have used intersectional approaches to increase the inclusivity of their work. I'm really excited to introduce James. We have James next, okay? James from ONS, and after that, we'll hear from Emma Jolly at State Savers. So James Harris is a city statistician at the UK's Office of National Statistics. James will be highlighting an example of how the ONS has strengthened data disaggregation and what outcomes this has led to. So over to you, James.
Thank you very much. I hope everybody can hear me. So I work in the Centre for Subnational Analysis, and we work with local areas to deliver statistics and the data that they need to implement local policies and deliver local services. So we're very much doing the identify of what Mike introduced earlier. So if we could go to the next slide. Over many years, we've spoken with numerous cities all across the UK, including London, Manchester, Bristol, Birmingham, and Sheffield, to understand their needs right now in order to tackle the current COVID-19 pandemic. They need to understand who the population is, who's most at risk of the virus, how many people were infected or had died from it, whether people can access groceries, medical needs and support networks, who their key workers are and details of those key workers, which businesses were at risk of closure or insolvency, who might be affected by these closures and whose jobs might be lost as a result. Fundamentally, the authorities needed more information about people, the people that they have responsibility for. So if we go on to the next slide. So over the last few months, our department and our centre has specifically been creating new sources of information to fill those needs. Outputs such as measuring deaths, measuring the impacts of the pandemic on people's well-being, their understanding of the situation, their attitudes toward finances and their future, and of course, plenty of information about people's jobs. So we've continued producing outputs using our typical sources like the labour force survey, breaking jobs down by age and sex and ethnicity and disability and nationality and other measures, all at the local level, for policymakers to understand the characteristics of the people who would be most affected by the pandemic, how they're affected, and where they were. And we've also used new sources, including a new module of the Opinions and Lifestyle Survey, a new Business Impacts of Coronavirus Survey, and new investigations by our data science campus to understand the direct impacts on people's lives, again, breaking this all down by personal characteristics. So if you go to the next slide, my last slide. So here are a couple of specific examples. On the left was part of our job quality publication, where amongst a very large amount of information, we identified that when breaking down by ethnic group, it was particularly people of Bangladeshi ethnicity who were more likely to be in low-paid employment than any other ethnic group. And specifically, it was Bangladeshi males that were most likely. So knowing this, local authorities can then create new outreach programs such as translation services or career services or skills training or whatever it is that they identify locally that they have powers to achieve at specific sections of their communities to support people and help them improve their situation. I've put the links to the two things that I'm specifically talking about here in the chat box. On the right-hand side is part of our analysis of the social impacts of the pandemic, so investigating which areas were the most worried by the pandemic as part of a wider analysis of how well-being was generally being affected. So we're currently breaking the results down by a wide variety of personal characteristics, even including household tenure and health conditions, and we're taking a modeling approach right now to understand which personal characteristics specifically contribute to the specific outcomes we can see, such as the likelihood of being unemployed, the likelihood of taking the vaccine, and the likelihood of being sufficiently well informed about what is happening. So trying to identify which of these characteristics are the most important to the outcome that we're seeing, and which of these characteristics interact with each other. So is it specific age groups, specific sex, specific ethnicity, or is it collections of these sets of people, and who is it that we need to target our support most at? So we're doing this with all sorts of our publications and outputs. However, the analysis is very heavily hampered by the sample sizes of the data collected, by the variety of variables that are not collected, and by the fast pace with which the situation is changing. So whereas we have huge sources like the census, it's many years old, or new rapid sources like scanning tweets that gives very limited personal information, or sources like tax records, we have very limited demographic information. We're also trying to measure the smallest breakdowns of vulnerable people here, so they're potentially the hardest people to analyze because we're looking at very specific groups in very specific areas of the country. So ONS is working to find new sources to link the data together and to enrich our existing sources so that we can add more detailed breakdowns to all our various outputs. So specifically, my team, we're working with colleagues in the Inclusive Data Task Force, the Center for Equalities Inclusion, the Center for Homelessness Impact, and a wide variety of other teams to analyze the population and the workers in support of local areas trying to improve the lifestyles of their citizens, lifting people out of poverty, and tackling the issues around inequality and deprivation. We are providing huge amounts of information to the local areas towards the UK's levelling up agenda and to ensure that we're not leaving anybody behind. So trying to identify these groups of people, what potential problems they might be facing, and trying to include them in all the changes that are happening.
Thanks so much, James. Really, really interesting work, and so much, so many connections across different groups within the government, and very exciting to see. So now we're going to move over to Emma Jolly from Sightsavers, who's going to tell us a bit about how Sightsavers has been using disaggregation to understand the relationships of different intersecting dimensions to improve the inclusivity of their programs. Over to you, Emma.
Thank you. I hope you can hear me. I'm the Global Technical Lead for Health and Disability Research at Sightsavers, and we're an international NGO who work predominantly in Africa and Asia with two major aims. So the first is to promote equal opportunities for people with disabilities in society, and the second is to eliminate avoidable blindness. Now, we use evidence in a range of ways to guide and evaluate what we do. And we have a monitoring, evaluation and learning team, but we also have a research team dedicated to this. And today I'm going to spend my 4 minutes talking you through one small example from our work. So next slide, please, teacher. Thank you. So one of our main areas of work over the years has been to strengthen health systems to respond to avoidable blindness, the leading cause of which globally is cataract. Now, cataract is, of course, easily and cheaply treatable, but many individuals are unable to access treatment. And the published evidence tends to suggest that it's older women from poorer communities who are the most disadvantaged. And thus, a lot of services are really designed to reach older women, as it's assumed, rightly so, that they are normally the most in need. Now, at Sightsavers, we conduct regular monitoring of population level coverage of services. And this slide shows some of the factors associated with severe visual impairment and blindness from a survey we did in Kogi in Nigeria towards the end of 2019. And I know we've got some colleagues from the Nigeria office on the call. As part of this survey, we surveyed around 4,000 people aged over 50 years, and we found an overall prevalence of severe visual impairment and blindness to be about 5.5%, so slightly more than 1 in 20 people. But prevalence was higher, as you can see from the table, in certain groups, and it was men, people living in poorer households, and people with additional non-visual disabilities who were more likely to report having that visual impairment than women, richer people, and people with no other additional impairments. And I should say that we did collect other personal characteristics and other sorts of data as well, but given the time and space constraints, this is what I'm focusing on today. Now, of course, they're not mutually exclusive categories, but if we want to understand how people with a different combination of characteristics experience eye health, then disaggregation alone isn't enough. These crude categories, you know, they can only tell us really about one characteristic at a time. There aren't enough dimensions within a table to look in more detail. So just moving to the next slide, please. So we built on those crude analyses by developing a number of multivariable models to help us explore the relationship between different types of characteristics that we were interested in. And in this case, with the binary outcome variable, of course, we used a logistic regression model to explore those associations. Now here I'm just showing the results of one model that showed how we explored sex, disability and wealth combined. And I should stress that visual impairment is very highly correlated with age, and so all these results are adjusted for age already. So after we stuck them in the model and we saw that looking at everything all in one go, there wasn't much of an effect due to sex or wealth. It actually was that additional impairment on top of the visual impairment that was really increasing the likelihood of one having a visual impairment. However, we also used an interaction term to understand the relationship between disability and sex, to understand whether or not having that additional impairment was different for men than it was for women. And we did actually find, quite interestingly, that the predicted probability of having a visual impairment among people with disabilities was different for the men than it was for the women. And actually, the likelihood of women having a visual impairment decreased as they got older in comparison to the men, which is not really what we were expecting. So these results are slightly at odds with the perceived wisdom that it's older women who experience the worst health outcomes from men. And of course, they are just from one study location and can't be generalized too far. But they're among few published analyses looking at these factors in this level of detail, and they do raise important questions about who has access to services and what needs to be done to overcome the barriers for people who are most at risk for not accessing the services. So this was really a whistle-stop tour of one analysis from one study. On the next page, there's a link to our research website, and I can also put the link to this particular report in the chat box if anyone is interested.
Thank you so much, Emma. Really fascinating results, and I'm sure many folks will go to that study and go to your webpage. Also encouraging again our panelists to take a look at those questions coming up in Slido. There are very many very good questions. We will try to circle back on some of them at the end, but we won't get to all of them. So encourage you to respond right there in the chat, to have a discussion. What we wanted to do now is a little bit of a break before our next two speakers, is to launch a poll together to get a little bit more input from all of the great expertise among the participants in this webinar. So go ahead and launch the poll, please. It's in Slido. The link is there. The question is up there on the screen. To what extent is your organization applying an intersectional approach to data? So please head over to the Slido and answer that now. We'll put up the results in just a minute. This is going to be a rapid poll. Just would love to get that input, and you can see it happening in real time now. Great to see the input from folks on the line. Wow, we're at 46% for often and 25% for occasionally. So that's quite high. And I suspect that those who haven't had as much experience, and 15% for always, but haven't had as much experience, are looking forward to learning from everyone on this webinar. So that's really exciting. I see the numbers moving a little bit, so we'll give maybe 30 more seconds to capture a little bit more data. If you haven't had a chance to do that already, please vote. Between always and often, we have 67%, it looks like. So that's quite high. Excellent. All right. So now we're going to move on just so that we can keep moving and allow as much time for questions as possible. Don't hesitate to continue to vote. Now we'll be hearing from UN Women and the International Displacement Monitoring Center on their learnings from their work and projects to strengthen data disaggregation. So first we'll go over to Jessa Encarnacion from UN Women. Please, over to you, Jessa.
Thank you, Jenna, and thank you to the organizers for hosting this side event, and also for inviting UN Women to share our ongoing experience as far as inclusive gender data production is concerned. Next slide, please. Now, Women Count, just to say that Women Count program is UN Women's global gender data program, and part of its efforts is to generate disaggregated gender statistics by using already existing data from household surveys. And in this regard, we're doing that through the production of the Counted and Visible Toolkit. And while of course this is a joint effort by the UN Women as well as the Intersecretariat Working Group on Household Surveys, much credit is due to our national partners, particularly the NSOs and the Ministry of Women, who without them, we're not able to compile all these country examples and tools that we would like to share to national statistical systems. Next slide, please. So what does the toolkit does? So first, it tries to take a holistic approach to inclusive gender data production. So more often than not, you'll see, I mean, on your screen, you see the one on the middle, you have like, it's not uncommon to find good documentation of various methodologies, statistical processes for the production of disaggregated gender statistics. However, guided by a principle of nothing about us without us, we wanted to ensure that the inclusiveness of this process would also include the entire gender data production. So for example, we don't treat it as a one-off statistical exercise, but rather an inclusive and sustainable process. So for example, in stage 1, we have identified the counterexample to ensure that the leaders of the national statistical system are committed to undertake this activity. We have, for example, Cameroon, which created a permanent working group on gender statistics led by no less than their chief statistician, and likewise creating an interagency working group on gender statistics so that discussions are not only within the NSO, but rather across the entire statistical system. Secondly, on stage 2, the identification of priority gender indicators. We try as much as possible to promote to national statistical systems that in identifying which gender data to produce, it's not about what is there in the data set, what is computationally possible, but what is more important is what is actually policy relevant to them, that what will they actually use rather than what is interesting to know. Now, third, as I already mentioned, the methodologies and production of these priority gender indicators. I show there in the middle the example that we had with Pakistan, exhausting the potential of DHS data from Pakistan, making use of their GIS module so that we can see the state of women on particular subpopulation groups, looking at simultaneous or intersecting deprivations. Now, the fourth is on the assessment and publication of results. Next slide, please. When we do disaggregated gender statistics, we have to look at more disaggregation variables. So just take, for example, the Mongolia experience that we had. We wanted to look at the indicator proportion of child marriage among women aged 18 or over. So, and then we wanted to look at the dimensions on income, on location of these women. Of course, with more disaggregation variables comes with less number of observations, and with less number of observations, we increase the likelihood that these numbers are less precise as measured by the standard of error, that these numbers are less reliable as measured by the CV or coefficient of variation. Next slide, please. So just to illustrate, these are not the estimates for the proportion of child marriage among women and 18+, but rather the quality reliability of the estimates as we go down further into disaggregation. So you can see there, if I point you to the last row on this slide, when you look at the proportion of child marriage among women aged 18 or over, those belonging to the poorest quintile and those living in urban areas, while you are able to get these estimates, the reliability level or the coefficient of variation is estimated at 30%. The CV, we would like it to be as low as possible. The lower the CV is, the more reliable the estimates are. So at the end of the day, we can say that, while it is computationally or statistically possible or mechanically possible to generate these estimates from existing microdata, we have statisticians to ensure that we are aware of these limitations, and likewise we also have this responsibility to make our users aware of these caveats. We increase also their statistical literacy and appreciation of these estimates. Next slide, please. And then lastly, on these stages, we promote obviously the dissemination and advocacy, but more arguably uptake and use of this gender statistics. So we have, for example, Colombia. They released last November the first ever women and men publication, and no less than the female vice president of Colombia graced that event. While of course that's really noteworthy to have, what is also important to stress is that beyond the launch event, they have now used these estimates in developing a more gender responsive, data-driven VNR as they are reporting this year. Secondly, they're also committed, the DANE committed to doing it on a sustainable basis in the sense that it's annually produced now. And then thirdly, a subnational publication to show the different situations of women and men across regions. Next slide, please. So what else that the toolkit offers to its reader? It showcases country-led experiences. So we wanted to ensure that the toolkit talks to its target users, the NSOs and the NSS. So while of course there are global partners who have similar experiences, we wanted to ensure the relatability of this to their peers in NSOs and NSS. Thirdly, the utilization of existing data from household surveys. We didn't go beyond promoting new tools or new surveys, but rather achieving the full potential of what is already existing out there. And then lastly, underscoring that this is a living document. We tried to be as comprehensive as possible in these tools that we are presenting, as well as country examples. In the full publication, we'll have roughly at least 22 country examples, but this is in no way complete. So it's far from being one. So we encourage countries to share their own experience, and we will periodically update this on our online version. Next slide, please. I'll skip that part. Next slide, please. Now, lastly, on the key learnings. So I think it cannot be overemphasized that the process should be user-oriented rather than product-oriented, and that in selecting the gender statistics to be disaggregated, it should be guided by its policy relevance. And likewise, if we promote that both the NSO and the National Women's Machinery take co-leadership and shared roles, both the major data producers and the major data users, so that we're bridging the gap between data production and use. Also, the existing data can be further tapped to produce statistics beyond what is traditionally generated. We've seen that from the examples, not only from this one, but from other colleagues today. Process also calls for capacity development activities. So engaging the entire system does not only look at it as a computational exercise, but also capacitating understanding and understanding of both data producers and users in the process. And of course, need to examine whether disaggregated gender statistics are sufficiently precise and reliable. So where do we draw the line on what is reliable and precise? That is always the question. When do we disaggregate or not? And then lastly, the principle of nothing about us without us. We want it the data to be inclusive, but also the process of producing this data to be inclusive. Hence, not only quantitative assessments should be made, but also qualitative assessments such as consultations that will involve the specific population of interest should likewise be undertaken. Lastly, more details can be provided by our group in also in a webinar to be held on Wednesday, also at the same time at 9 o'clock. Please visit our website, data.unwomen.org, for more details. And the launch of the online version of this toolkit will be done on March 3rd on the margins of the UN Statistical Commission. So again, we invite you to visit our website, data.unwomen.org. Thank you.
Thank you, Jessa, and congratulations for all this great work. I'm sure these tools are going to be incredibly helpful for many different stakeholders. So now we're going to move over to hear from Christelle Cazabat. Christelle is the research manager at the Internal Displacement Monitoring Center. She's going to be discussing some insights that have emerged through their work to get more granular data on the lives of internally displaced people. Over to you, Christelle.
Thank you very much, Jenna, and thanks to the IDC for initiating this very important conversation. In the next 4 minutes, I will try to very concretely present to you what it means for the Internal Displacement Monitoring Center to apply an intersectional approach to data on IDPs. At the Internal Displacement Monitoring Center, we analyze and we collect information on IDPs with the overall objective of informing better support. And for the first 20 years of IDMC's existence, we focused on estimating the number of internally displaced people across the world. Behind this work was one underlying argument that all IDPs are affected by internal displacement. We need to know where they are and how many there are to even start supporting them. But 4 years ago, we started digging deeper into this argument. And this was the first step towards an intersectional approach to data on IDPs. We knew that all IDPs were affected, but also that each IDP is affected differently. Some people are only displaced for a few weeks, while others remain displaced for decades and live in very severe conditions. So going beyond the number of IDPs is essential to understand the kind of support they need. Of course, we soon realized that sex, age, and other characteristics such as disability status, education, or income level influence the way IDPs are affected. By understanding these influences, we can take an educated guess at the needs of specific groups of IDPs, such as children, women with disabilities, older people from low-income groups, for instance. This is useful to plan for more comprehensive and inclusive support. So to sum up, our approach follows 4 steps. First, identify locations where IDPs have found refuge. Collect data on the way displacement affects their livelihood, their security, their housing conditions, their health, or their education. And then disaggregate this data by sex, age, income group, and disability status. And lastly, and perhaps most importantly, analyze the data to identify how different groups of IDPs are affected differently. Try to understand why, and most importantly, what can be done to support their specific needs. I will now give you a real-life example of how we applied this approach to investigate the effects of internal displacement linked with drought in Somalia. So the first step was to identify IDPs who had found refuge near the capital city of Mogadishu and conducted a survey to assess the impacts on the education of their children. The survey's initial results showed that displaced children were going to school more in their host area than in their area of origin. This was because in rural Somalia, where they came from, schools are very rare. Had we stopped our analysis there, we could have thought that displacement had actually a positive impact on education and that no support was needed in this area. But we continued our analysis and we found that boys were going to school a lot more in their host area, probably because they no longer had to keep the herd their families had when they lived a pastoralist life in their area of origin. Girls, however, were going to school a lot less. It was not clear why at first. Schools were set up in the IDP settlement and they were free and easy to access by foot. So we continued our analysis and we found that displaced families with higher income were sending all their boys and their girls to school. But families with lower income could not even afford school supplies, and they had to choose between sending their boys or their girls. And faced with this decision, most of these families would send the boys. So I think this is a clear example where using an intersectional analysis allowed us to highlight a very severe need for education support to displaced girls from lower income families, which would have gone completely unnoticed without this approach. Data disaggregation and the intersectional approaches have helped us go from a global, uniform picture of internal displacement to a much more granular and informative representation of IDPs' needs. With this, I think I reached the end of my 4 minutes. So thank you very much. I'll stop sharing.
Thank you so much, Christelle. That was really, really interesting. So we have just a little bit of time to circle back, leveraging some of the questions in Slidos for a couple of the speakers. What I'm going to do is I'm going to pose a question to one or two speakers. I'm going to ask you to try to answer it in maybe a minute each so that I can get one in for most of you. A first question we have at the very top of our Slido list, sort of the most popular question, is around the kind of differences in national and even local context in the language that's used to describe different groups. So the question being asked here is about race and ethnicity. It flags certain acronyms, BAME in the UK, BIPOC used in the US, et cetera, and how that type of language it might be addressed through global standardization, or if it can be, or what challenges are faced in doing so, and how, from a national perspective, those differences in context may affect how you approach this question. So what I'd like to do is I'd like to first turn to Jessa from UN Women to ask about some of these challenges with respect to language and different national contexts at a global level and thinking about global standards. And then I'd like to hear from James and Karen to respond from a kind of national perspective. Grateful if you all could just take a minute and then we'll try to circle back with one more question. Over to you, Jessa.
Yeah, thank you, Jenna. So just quickly, two points. First, on at the global level, I think we are one in saying in terms of there's no globally agreed terminology or language that would cover everything. It would be good to have that. It's something that, you know, it's a challenge and probably to all of us working on this area to develop. And then secondly, in terms of producing this information also, I think we also have to ensure that global partners, when we develop tools and recommendations, even on data production in general, intersectionality should be the default option rather than an afterthought. To this day, many of our summary tables still cover the traditional summary tables that we've had years ago, and breaking that silos on how we present statistics would enable us to have more inclusive data. Thank you, Jenna.
Thank you. Over to you first, James.
Yeah, it's a little complicated in as far as we do engage an awful lot with international levels wherever we can. We do an awful lot of engagement with the OECD, with the UN, with Eurostat. Even though Brexit, we still engage with Eurostat, and we're trying to answer a lot of the classifications like occupation and industry, which are relatively easy on a global scale. The problem with questions such as this is we're trying to look at individual groups and sets of people. So whereas the UK has a lot of people from India, Pakistan, Bangladesh, the USA has an awful lot of Latin American and African American people. If we try and do a lot on Latin American people in the UK, we get very small sample sizes, and it's very difficult to actually analyze the information because there's so little information there. So trying to do specific bespoke analysis for different countries where they all have different demographic makeups and different designs is very difficult. But we are engaged in all sorts of intergovernmental panels in terms of trying to create these classifications that try to best meet everybody's needs. But at some point, it does have to come down to the individual countries themselves to figure out what breakdowns best work for them.
Thank you, James. And Karen, any thoughts on this one?
Thank you, Jenna. I think I agree with James. It's something that can be very particular for each territory. For example, in Colombia, we have some official tables of working with ethnic organizations in order to prioritize and make agreements around which questions, which categories. And this is a historical process of recognizing their knowledge and their needs to include specific questions that fill the needs of information to make visible ethnicity. So it is not that easy to, for example, in our case, study international experience on that, because our local normative and social organization structure invites us to agree and work together with ethnic groups to establish ways of collecting and a structure of questions. And this is also very important for the acceptance of this information then when we are using it. And in our region, I think ECLAC has made an important work. For example, studying and presenting documents around how has been this included in census, for example, in all over the region, where we have things in common. So maybe a regional context could be useful to study this question.
Thank you. Now I'm going to try to slip in one more question to be directed to Emma and Christelle. Again, I'm begging you to be as brief as possible, but I think a very important one from both Sightsavers and IDMC perspective, which is we've had it in a few ways on Slido, question around the sort of effects on marginalized or vulnerable people of having more data on them. So thinking about persons with disabilities, thinking about displaced persons, how do you, in your own work, think about the privacy and rights needs of those individuals? And how do you ensure that that data gets back to those communities so they not only understand the process and reason for collecting the data, but can think about how they might use it to achieve their objectives? So first to Emma and then to Christelle, please.
Thanks. Yeah, excellent question. I think one of the ways we do that is we work quite closely with organisations of persons with disabilities in the research that we're doing, and we try and engage them right from the outset, so in the design of the work, as well as the actual conducting and sort of using and disseminating at the end, you know, right from the outset. We work with them to make sure that the study objectives and the tools that we use, the actual question sets, are that work for them, and that we're, you know, everything is being done in line with their objectives, and that there's nothing else we can include in our surveys. We're also quite careful to plan dissemination events right from the outset. So we obviously do a lot of research in Africa and Asia in very sort of remote communities, and it would be very easy to take data, go back, analyze it, and put it on a website that no one will ever see again. So we're quite careful to yeah, try and, as much as possible, plan to get results back to communities whenever possible, and to the people who are going to use them. And yeah, we're very careful to stick when it comes to like data management and sort of privacy and all those kind of things. There's obviously standards, not just GDPR and UK focused standards, but there are research standards, and in countries, you know, institutional review boards provide oversight and ethical kind of guidance in how we collect, manage, store data, and we're very careful to abide by all of those things where possible. I'm sorry, you had a lot of questions in there, but I think that was it.
Yeah, thank you. Over to you, Christelle.
Thanks, Jenna. I'll try to be quick, but there are actually two questions in your question. And the first one is about sort of the security, ensuring that we do no harm when we collect this kind of information that can touch upon very sensitive topics. First of all, being internally displaced in some context is already something that can put you at risk. And then if we add to this a layer of collecting information on ethnicity, there was an excellent question around this in the Slido, or around sexual orientation or different characteristics, this can really put people at risk. So we are very careful to either not collect that information, of course, when it can turn out to be a danger. Of course, never collect any personal data that would allow people to be identified. And whenever possible, and it is useful, we try to use proxy indicators. For instance, for ethnicity, sometimes we can rely on the main language spoken at home to at least give us a sense of the ethno-linguistic group the family pertains to. And then just super quickly on your point about getting the research back to the people, I think the way that we do this at IDMC is mostly through ensuring that the information is then used to support them better. And I think that's one of the most efficient ways to get the data useful for them. And we do this by actually designing our surveys and our research projects with for instance, humanitarian organizations that are already working with IDPs in the locations where we conduct research, or the government or the agencies. And we really work together in the planning phase to make sure that the data we collect will eventually be useful for those programs and therefore also for the IDPs.
Great, thank you, Christelle, and thanks everyone. I have to congratulate all the speakers, not only on the incredible depth, innovation and creativity shown by your presentations, but how incredibly disciplined you've been with your time and being incredibly substantive while doing so. So a huge congratulations to our speakers, and a huge congratulations and thank you to all the participants who've been so actively listening and on Slido. As we wrap up this event, we're going to invite you to take a poll on Slido just to give us a little bit of feedback and to improve discussions for the future. So please check your Slido and enter your responses in that poll. I want to share just 3 summary points that have really come out of me in the course of the discussion. The first is in all the presentations have emphasized data use. So it's not disaggregation for the sake of it. It's not looking at multidimensional characteristics just for the sake of it, but engaging in data users, engaging in policymakers, and asking what information is really needed, and then applying the approaches. The second one is innovation. It's incredible to see across all the organizations that have spoken here, the amazing creativity and work that is ongoing to use different data sources, different methods to address the issues related to small sample sizes. So an incredible amount of innovation. And the last is